The measles outbreak is accelerating. This is not a headline from the 1950s, nor is it an old episode. It is December 2025, and this is the reality in the United States under Donald Trump. We are facing yet another measles outbreak driven by growing anti-vaccine sentiment. The latest cluster is in South Carolina, and it is accelerating due to the effects of Thanksgiving travel within a church community that has low vaccination rates. To clarify, I am not alleging that the church itself is officially anti-vaccine. Rather, the outbreak is centered around unvaccinated congregants of a particular church, and the virus is spreading rapidly. Of the 111 measles cases in the area, 105 were unvaccinated, which highlights just how effective the vaccine is. Based on the available data, another 3 cases involved individuals who were partially vaccinated. Presumably, partially vaccinated refers to children who have received only one of the 2 standard MMR, measles, mumps, and rubella doses. The first is typically given at 12 months and the second before kindergarten at age 4 or 5, leaving them in an interim status. In addition to the cases found mostly among the unvaccinated, 254 people are currently in quarantine in South Carolina, and much of this preventable outbreak traces back to the Way of Truth Church in Inman, South Carolina. I recently spoke to a pediatrician about traveling with a baby prior to 12 months of age. She noted that while the MMR vaccine schedule could be adjusted for travel, she would currently be far more worried about a family traveling to Texas and to France regarding measles. Regarding what's being called the upstate South Carolina outbreak, 20 of the cases involve children under the age of 5, while 75 cases are children between the ages of 5 and 17. Across the state of South Carolina, the student vaccination rate has dropped from 96% to 93.5% in the 2025 school year. While that may not sound like a significant difference, it is actually huge because measles is so highly contagious. The virus has such a high reproduction rate that a very high level of vaccination is required to maintain herd immunity. While one might argue this is the responsibility of the governor, the church, or local officials, we must contend with the reality that at the federal level, specifically within the White House and the Department of Health and Human Services, we have a president and a secretary of HHS, Robert F. Kennedy Jr., who have reinforced and encouraged anti-vaccine sentiment. It is important to note that while Trump capitalizes on vaccine skepticism and appointed Kennedy, he continues to receive his own flu and COVID vaccines annually. He seems to understand the medical reality, but also recognizes the political benefits of aligning with anti-vaccine sentiment. It is worth remembering that the US declared measles eliminated in the year 2000, meaning there was no domestic spread for over 12 months. We eliminated measles thanks to the vaccine, and it has now returned due to anti-vaccine sentiment. As of 2 days ago, there were 1,112 confirmed cases and 47 outbreaks of measles in the US in 2025. Of those cases, 92% were unvaccinated and only 4% were fully vaccinated. The vast majority of cases are concentrated in a few states. Texas has the most, followed by South Carolina, Utah, Arizona, and New Mexico. In contrast, New England shows almost no activity. There are 0 cases in Maine, New Hampshire, Massachusetts, and Connecticut, while Rhode Island has 1 case and Vermont has 2. These stunning numbers serve as a reminder that this situation is optional, and the fact that it is optional makes the persistence of the disease completely immoral. I know some believe that refusing safe and effective vaccines constitutes child abuse and that children should be removed from such environments. While I am still considering the legalities of that argument, what is clear, legality aside, is that there is no moral justification for exposing children to potentially serious and deadly conditions when a safe and effective vaccine exists.